And then we have now, of course, at the top of the hour, a tremendous interview that will be taking place with one of the leaders of the US healthcare system when it comes to labs. Labcorp is, as most of you know, a household name when it comes to the lab systems in the United States. And if you haven't been following the news, it's also one of the leaders, if not the leader now, in mobile phlebotomy and getting your labs taken at home. It's also the first lab in the United States to have a home-based monkeypox test as well. So they've also done some very, very innovative strategic partnerships with folks around the country directly related to the healthcare system, including a very, very nice deal with Atlantic Care Systems in New Jersey. So again, Labcorp is just doing some amazing things, and great to have both Seth from Digital Diagnostics as well as Sharad from Labcorp. Thank you both for joining. Thank you, Seth, for moderating.
You bet. It's very nice to be back again, of course, Stan, and love all the things you guys are doing at HITLAB. By quick way of introduction for me, I have the great pleasure of serving as president and COO at Digital Diagnostics, where I help a fantastic team to run and, of course, grow that business on a day in and day out basis. In terms of Digital Diagnostics, a little bit about the company. Our mission is to transform the accessibility, affordability, equity, and quality of global healthcare through the use of technology, and specifically through medical diagnosis and even the treatment process. And our flagship product, as some of you may know, is IDXDR, which was the first ever autonomous AI in healthcare that did not require a physician overread, and of course comes with that unique ability to scale into non-traditional settings, which I think is a nice way for me to let Sharad talk a little bit about Labcorp.
That's great. That's fantastic. And Sharad, again, if you could give us a little bit of background on yourself as well and what you do at Labcorp.
Yeah, absolutely. First of all, I appreciate you guys getting us here. Really excited about this panel. Nice to meet you again, Seth. It's been a while. Labcorp and Seth have been connected at the hip for a while now, it seems. So yes, I joined Labcorp very recently, so I might not be able to provide a full perspective on everything we do. I've been here about 6+ months now. But broadly, my career has been in the healthcare industry last 20-odd years. Started off as a physician, mostly in intensive care units. Did some work with startups, actually brought a diabetes screening device, which was not as autonomous as Seth's. Seth's is way better. But we worked on that technology in San Diego in between 2012, 2016 timeframe. But since then, I've been mostly involved with the investments world. Last 4 years with United Health Group, and now with Labcorp. So it's really interesting. My career has taken me at all these different places, just getting a full perspective of healthcare. And I think Labcorp is one of those really interesting places which can affect people's health in so many ways, and where this whole concept of AI and leveraging autonomous AI really becomes really fruitful, and it enables health across the continuum in the US as we know it.
Yeah, it's fantastic. And I think, again, as we're seeing this, and as we're talking about digital and using digital as a way to improve access and improve equity in healthcare, we're reading so much and we're studying so much about how AI and machine learning can do that and help make things more affordable and more accessible and improve outcomes for people, not just in the US and some of the wealthier nations, but also the lowest income nations around the world as well. And Seth, lead us off a little bit, talk a little bit about, again, for some of the audience here, what is the definition of autonomous AI, and what are you seeing, and where are you seeing this? First, before we talk about the access and equity components of that, what are you seeing, and where are you seeing it have the biggest impact within healthcare right now?
Yeah, so I think it's a great place to start, as you mentioned. And for me, the best place to, or the easiest way maybe to differentiate is to first start with, I think most people might be familiar with stuff like clinical decision support, advanced analytics, any way that you have data, medical images, those types of things that are having AI applied to it in some manner, shape, or form, that ultimately then goes to a provider to make that diagnosis. We categorize, and I think the industry largely now looks at those as assistive AI. And there are, I think, of course, many good use cases for assistive AI, but important to differentiate, as you call out, Stan, a little bit different than what we do today. And that is autonomous AI is sort of the opposite of that, right? Which is, as I talked a little bit about what the company does, the important distinction there is no place in the process where once we have, in our case, medical images or high fidelity data, where those are then being sent and we're waiting for a physician to also review. That was what was so both groundbreaking and illustrative of what the FDA, as well as some of the other validation points, the American Diabetes Association, the NCQA helped us validate is our autonomous AI is the computer actually making that medical decision or diagnosis for the patient. So we can, of course, get into the how exciting that is from a scalability standpoint, and in particular, how working with a partner like Labcorp might make that really interesting. And of course, then that leads into our topic for today of access and equity. But hopefully that's helpful as a definitional starting point to your question.
That's a great starting point to the question. And again, I really appreciate the not only the background and some of the connection points and some of the cases that you're seeing, but also the definitional components too. And Sharad, I think it would be great to hear more about what you're doing with AI at Labcorp and where some of the kickoff points are around access and equity there as well.
Yeah, and we all know, I mean, Labcorp has a really big sort of brick and mortar presence, right? Like 2,000 plus PSCs. So if you think about it, we are connected to a majority of the US population within, I think, a few miles of their homes. They can actually enter a PSC. Now, if technologies like Seth, if we could bring together the infrastructure where deploy what we've already created with these new technologies that are coming up, deploy them in our locations. Now, even though in rural areas or areas where clinicians might be a luxury, for example, if this autonomous type of AI can be deployed in existing locations, now you've actually taken one layer of complexity away, right? Now, you don't have to necessarily hire or keep clinicians in those locations because, well, we have an existing PSC, and now the patients can go in, get tested, get the right kind of diagnosis without the need for that clinician. So we have an existing infrastructure which we would like to deploy for things like this, right? And that's why we, through our venture fund, we continuously look at all sorts of investments where we might be able to bring them to our locations or broadly to people's homes, right? Because we have this on-demand kind of program. We invested in a company called HITLAB so that we can take tests directly to the patients. As we think about all these various ways that Labcorp can get testing to the people, we want to overlay a new layer of technology or health tech or AI-enabled services that might be able to get patients information that they need faster. And then maybe if the clinicians are not needed, even better, right? Because, for example, if there's a way to reflex test based on what we just got, and the autonomous AI makes a decision, sends the next level of testing, now you've removed one step where there could be time delay and all sorts of things. So that's sort of what we're doing with our investments, and our groups at Labcorp are very interested in leveraging all the new modalities within AI, assistive and autonomous.
It's fantastic. No, that's really fantastic. And I know, Seth, before the session, just talking through things with you, there's a lot that digital diagnostics is doing to improve access and equity. Obviously, that's the core of the topic today that we're discussing in this symposium this month. Talk a little bit about what you guys are doing specifically to improve access and equity through your AI technologies.
Yeah, so for us, it starts with design, meaning if you think about putting an AI out into the wild that is potentially unsafe or in its design is potentially biased, you get into a really bad place really fast. So you might then appreciate our deliberate approach towards, and our tagline even of doing AI the right way is core to how we build our products. So for us, it starts with design, meaning we don't do black box algorithms where you don't actually know what's going on. We have good transparency, traceability, and good explainability for the algorithms that we build. I also mentioned before some of our sort of validation points or proof points there, meaning as I referenced, we didn't just put this out and see how it went. We started with patient safety first with the FDA. And then we also worked with several other organizations like the American Diabetes Association, the National Committee for Quality Assurance, to make sure that what we were putting out was both safe and effective, and inherent or core to that is making sure that the technology is invariant to things like race, ethnicity, gender, et cetera, right? So that first bucket you can think of sort of as just designing products that meet that criteria, and we know are safe, effective for all kinds of different patients and patient populations. The other thing that I would mention that I also talked about a little bit around our mission is just the core of what we do is provide access. And so what I mean by that is, if you think about the years and the resources, the time and resources, the dollars that go into training up, for example, a provider to get to the point where they can actually make this diagnosis for a patient, we can talk about years and years and hundreds of thousands, if not millions of dollars to have that one provider able to help the patient in diagnosing, for example, in our case, diabetic retinopathy. For our technology, we spent obviously many years making sure it was safe and effective, and of course, a lot of resources. But now we have something where anywhere you have an outlet, you can plug in access to high quality specialist level care. And that, of course, includes, and I think as we're highlighting today, underserved rural areas that really need some of that access. As an example, sometimes we overlay a map of the United States. And of course, we are looking globally, but in the US alone, in the Southeast, there is a very high prevalence of diabetes, and there is a lower number of ophthalmologists to test for diabetic retinopathy. So you have this supply and demand mismatch, if that is one example, where patients then ultimately wait 3 months, 4 months, 6 months to get in. And as you can likely expect, there are negative outcomes as a result. Patients start to lose their sight unnecessarily. And at the heart of that is an access issue for a variety of reasons, of course. So I like to highlight one example that happened recently for us that I think is a good way to illustrate some of what I'm talking about. We've been working more and more with FQHCs, federally qualified healthcare clinics. And there's one example in the Southeast where there are multiple locations. And in this particular group, compliance was very, very low, meaning the diabetic population, on average, not even 20% of those patients were getting tested every year to see if they were going blind, to see if they had diabetic retinopathy or macular edema. Additionally, about a little more than half of that population were racial minorities, and 95% of that population was at or below 200% of the federal poverty limit. So this is a patient population that has an outsized number of diabetic patients. They are not able to go get this test as they need it. And as you can expect, the outcomes there are not what we want at all. Within 90 days of us putting our technology into that clinic, we had doubled their compliance rate. And some people may say, well, what does that really mean? In the first 90 days, we found 30 patients that were in fact had a level of disease that needed intervention and treatment. And we were able to help refer those patients to get that treatment so they didn't go blind. So, in our view, and you can probably hear it as I talk about it, this is like core to what we do. And this is really making a difference in some patients' lives. And of course, we're proud of that. And we also see that this is absolutely what our technology is designed to do. So if that is helpful as we think about access and certainly equity, you can see that we are really trying to not just talk about it, but actually walk the walk.
Yeah, that's massive. I mean, that really is helpful, not only in the definitional sense, but also with some of the case studies that you're presenting there. And it's tremendous to see how far it's gone, and what we know, I think where it's going as well. And certainly, sure, I'd like to hear more about the, I think at some point it'd be great to see more about and understand more about some of the elements that Labcorp is doing as well. Would you like to add a little bit there on where you're seeing AI really lead the access and equity charge within Labcorp?
Yeah, absolutely. And by the way, I don't know, my video is off, not because of me. I think somewhere on your end, somebody has switched it off. But what I would like to say on that point is, I think two really important things, right? Seth brought up this concept of like making sure the AI is done right, or the algorithms are built right. Like, so we are actively pursuing a lot of initiatives within Labcorp. For example, in the past, we've seen all the blood tests have these values. To some extent, they might differ by weight classes or some of those. But for women, those values might be different. Those average parameters. For people of color, those might be different. So we, within our group, are actively taking the approach, and our group is full of like, these 15+ PhD researchers who are working on making sure the algorithms that we use are sort of enabled for this kind of diversity. And we are going through all of our data sets to make sure we build the right data sets for that kind of population, right? So that helps with the trust factor. And I truly believe that if people don't trust their AI, then adoption is going to be challenging, right? So that's where it starts. And then what other things Labcorp is doing? For example, we are looking at this company, and we'll probably at some point deploy them in various rural locations, etc. Where, for example, a phlebotomist might be a challenge, right? Getting a phlebotomist, I mean, for example, now you just put these devices with automated blood testing systems, but now the blood collection system is also automated, right? So now all you have to do is just walk into the location, put your hand in, get the blood test, and then based on all the various other systems we've put in place, we can actually get you right from diagnosis to the treatment places without the need of anybody, right? So putting in place all of these sequential systems that can completely, maybe take away the need for people to, spend part of their days, which otherwise they can't, because oftentimes what we see is people who need the most care can get to their doctors in time, or their schedules are messy. So we're trying to do away with a lot of those, and there's more similar initiatives in flight that I can discuss more, but I think we're running short on time, so I'll stop there.
No, it's fantastic, and really thank you both for joining us today. Just a tremendous conversation, really illuminating a lot of what's happening within the digital diagnostic space, and certainly within Labcorp as well. Thank you, Seth. Thank you, Sharad.
Thanks for having us.
With you.
Take care.
Bye.